Today we will be discussing, just watch.
The time has come to meet your baby. In this video I'll explain the basics of what to expect during labor and delivery. It is a good idea to familiarize yourself with the delivery unit by visiting the floor. Most of the nurses would be happy to show you around. Also be familiar with the entrance to maternity department, especially after hours. If you start having contractions, loss of fluid, vaginal bleeding or any concern, it's time to go to the hospital. Upon your arrival to maternity floor, you will first be seen by a nurse in most units, who will contact the doctor after an initial assessment. A healthcare professional will check your cervix to assess the dilation by performing a digital exam. If you are coming for an induction of labor, a healthcare professional will explain the process. That can be achieved by giving medications in the vagina that helps with cervical dilation, or by giving an infusion that stimulates uterine contractions, or by inserting a Foley bulb in the cervix to mechanically dilate the cervix. Those methods are safe and the baby will be monitored at all times. Sometimes your doctor might need to artificially rupture your membranes to accelerate labor or insert internal monitors by using an instrument called amnio hook. This is a safe intervention. If you are having pain, make sure you inform your nurse for the need for painkillers. There is a variety of medications that include oral and injections. But the most common pain relief method during labor is an epidural analgesia. Contrary to the historic belief, epidural is safe, effective, doesn't wear off, and it does not prolong labor. When you start pushing and based on the circumstances, your doctor might assist you with your delivery by using a forceps, which looks like big spoons, or a suction cup called vacuum. This is called operative vaginal delivery. They might also recommend a small vaginal incision called an episiotomy. You will be told everything and your permission is required before any intervention. Things don't always go according to plan, and sometimes it is important to perform a cesarean section. Although considered a major surgery, rest assured because all the doctors are highly trained at performing this surgery, and it is the most common surgical procedure. If you are coming for an elective cesarean section, make sure you follow the instructions about your last meal, what time to come in, and any other instructions provided in your last clinic visit. In the coming video, I will cover postpartum care. If you want to see more videos like this and would like to support this channel, please like and subscribe, and you will be notified when a similar video is posted.